To the U.S. now, and the White House is imposing travel restrictions on Brazil. Starting May the 28th, foreign nationals will be banned from entering the U.S. if they've been in Brazil in the last 2 weeks. Brazil's number of coronavirus cases is now the world's second highest after the U.S. President Jair Bolsonaro has been opposing guidelines like social distancing that have been imposed in other countries to contain the virus.
He's rarely seen in a mask, and his supporters like it that way. Compared with most world leaders, Bolsonaro has not been taking the coronavirus pandemic as seriously as he takes the economy. And figures published by the country's health ministry show the results. Brazil has the second highest number of infections in the world. COVID-19 has killed nearly 23,000 people here. Yet, despite the mass graves and the funerals, Bolsonaro's staunchest supporters still don't believe the numbers. You don't have to study politics very much to know what this is about. I saw the news about Brazil today. I think it's the country with the second highest number of positive cases. That's certainly a lie. They want to overthrow our president by dividing us. They want to divide us. Bolsonaro has enjoyed huge political backing from his US counterpart Donald Trump. They last met in March.
He's doing a fantastic job, a great job. Brazil loves him, and the USA loves him.
But a week ago, even Trump was clear there's a problem.
I don't want people coming in here and infecting our people. I don't want people over there sick either. We're helping Brazil with ventilators. We're sending them ventilators, okay? They need ventilators. I'm sending them ventilators. We have so many thousands of them. We're sending them. We're sending a lot of people. No, Brazil is having some trouble. No question about it.
Bolsonaro himself has not responded to the travel ban. He's happily in tune with his supporters, defying attempts to contain the virus.
Let's take a look now at some other coronavirus developments. Japan is set to lift the coronavirus state of emergency in Tokyo and 4 other prefectures. The move will allow businesses to gradually resume activity. New Zealand plans to further loosen its coronavirus restrictions by increasing the maximum size of gatherings from 10 people to 100. South Korea has reported 16 new cases. Authorities are trying to stem transmissions with 2 million more children returning to school this week. And Chile's president has warned his country's health system is very close to the limit as case numbers rise there. The country has just under 70,000 cases. And Spain has started the next phase of relaxing its coronavirus lockdown, with people being allowed to meet in groups in Madrid and Barcelona. The country's first beaches are also reopening. The pandemic has already cost millions of Spaniards their jobs, and that number is so high that welfare programs can't keep up with soaring demand for food aid. DW's Jan-Philip Schultz visited one Spanish family now dependent on charity food.
2 months ago, Manuel Ramirez wouldn't have believed it if you told him he would be in this position. In mid-March, the father of 3 was still a substitute teacher. Then his life went into free fall. First, he lost his job, then his wife lost hers, then the family had to use the last of their savings. Now he has to get food from the Red Cross. Without this charity, his family wouldn't be able to get by.
All of a sudden, I stood there and went through a whole range of emotions. First fear, then helplessness, then desperation, then anger. When it started, I tried to fight my emotions, but then I had to let go and accept what I was going through.
In the small town of Estepona in southern Spain, there are about 980 families who depend on food handouts. The fact that you see no lines here is because the local charity has a telephone appointment system, says social worker Pilar Vasquez. They do this to reduce the danger of infection, but also so those in need don't have to suffer the embarrassment of being seen there.
Now, middle-class families have been hit. For 2 months, they've had no income. But they still have overhead costs, rent, mortgage, and of course, daily expenses on top of that.
At least Manuel Ramirez doesn't have to worry about paying rent. Right now, his family is staying at his parents-in-law's apartment. But they have already used up their entire savings, around 800 euros. When the crisis began, he and his wife Inma joined a community call to help the needy. They bought 2,000 masks and gloves to give to charity. Now they still have hundreds at home. In hindsight, he thinks this might have been a mistake, but back then they thought they could count on receiving emergency help from the government. They are entitled to a few months of disaster relief funds, but up until now, they have not seen 1 cent.
They are ruining entire families. Were it not for charities and the incredible helpfulness of normal people, then at some point we wouldn't have anything to eat.
The two of them have been keeping track of how often they have called the social welfare office, more than 350 times. Sometimes the lines are busy, sometimes they get a recording, and when somebody actually answers the phone, the social worker explains the delay in payment has been caused by their increased workload.
They say they'll contact me, either by telephone or email. If I haven't heard from them after a week, then I should try again.
It's always the same story.
They feel lucky they can give their children a hot meal every day using the ingredients given to them by the Red Cross. Their kids have long accepted the fact that right now they can't get any new toys or even have dessert. All Manuel and Inma Ramirez want is to work again, or at least get their emergency relief money.
Well, refugees in Germany have started setting up support networks during the pandemic. Shelters in the country have become centers of outbreaks, with people living at very close quarters, even, they say, with those who are infected. DW's Bastian Hartig investigated the situation in the state of Bavaria.
Samba Ba is a regular at this textile store in Bad Tölz, a small town close to the Bavarian Alps. Samba is a migrant from Senegal. He comes here to choose the fabric for the face masks he makes together with fellow migrants and refugees. It's their contribution in an effort to keep the coronavirus at bay in the crowded refugee centers like the one where he lives.
In a room, you can have 4 people or 5 people in one room. They say that the corona can have in your body 14 days before it will soar. So you can have it and we are at the same place, we will not know. So then the whole place will get it. So we say this is the only way we can able to help them, to support them with the face masks.
Samba Ba is a member of a group of activists who help migrants and refugees all over Bavaria. Amid the pandemic, the group's special focus is on those who are in accommodations that are under lockdown because of COVID-19. Until recently, Ebu, also from Senegal, was under quarantine in a center in the nearby city of Rosenheim. On the phone, he tells Samba that people there are afraid of contracting the virus, because those who are infected were under lockdown together with everyone else. We visit a migrant center in Rosenheim that was among the hardest hit by the pandemic. It's been under lockdown for some 6 weeks. The local public health authorities are here to tell the residents that although there are currently no new known cases, the quarantine won't be lifted for at least another few days. Some here are growing impatient. I haven't worked for a month. My boss calls every day and asks why I don't come in to work. I've told him we're under quarantine and I'm not allowed to go out. It wasn't until recently that those who had tested positive for the coronavirus were taken to a different facility for isolation along with their families, after a month of quarantine. Simon Neuchel is a volunteer helper at the refugee center. He can't understand why authorities didn't act sooner. I think what was really needed from the outset was a plan for what to do if more than 2 or 4 people are infected. How can we accommodate people so they can live reasonably? In the schools, we're now dividing the classrooms up in a different way. There's been a change with physical distancing. Tables are empty. The same is true in beer gardens. But here in the center, everything's the same as it used to be. Many of the residents share bathrooms. Almost all of them share kitchens. It's practically inevitable that people are constantly getting infected. A spokeswoman for the regional government in charge of this and other centers says it has put sufficient measures in place to keep the refugees and migrants safe. We've informed the residents and the workers about how infections are spread. We use pictograms and put out flyers in different languages that explain hygienic measures that residents must follow, physical distancing rules, etiquette on coughing and sneezing, and why regular hand washing is important. There's disinfectant available. We're supporting the residents as best we can.
Wir unterstützen die Bewohner bestmöglich, soweit es uns möglich ist.
At Samba's accommodation in Bad Tölz, he and the other residents don't want to rely solely on the authorities. They say they've already made 26,000 face masks to distribute to other accommodations all over Bavaria. And they plan to keep going until their situation improves.
The epicenter of new cases and death tolls during this coronavirus pandemic has shifted over several months from China initially to Europe and then to the USA. There's always been concern about what could happen when the virus gets to less developed countries, and the numbers are shooting up in places now like Latin America. Australia's death toll stands at 100 and the number of cases here is relatively low, with the big issue for the moment just how soon the internal borders here will open. So here are today's key developments in our coronavirus coverage. So the World Health Organization says the highest number of infections has been recorded globally in a day, 106,000 cases. Russia now has the second highest number of confirmed cases, behind the United States, with the official count above 300,000. Brazil has experienced its deadliest day from coronavirus, recording 1,100 deaths in 24 hours. The country's government is encouraging the use of anti-malarial drugs to treat the virus. The World Bank is warning up to 60 million people will be pushed into extreme poverty by the impact of COVID-19. It says global economic growth is expected to shrink by 5% this year. The New South Wales Premier says the opening of state borders across Australia is a sensible thing to do and denies she's being a bully about the issue towards states which are being more cautious. Gladys Berejiklian also says she's considering easing border restrictions on international students. And the Northern Territory Chief Minister has announced the Territory is now free of active coronavirus cases. So some positive news there from the Territory. Queensland Premier Anastasia Palaszczuk has been holding a media conference in Brisbane. Let's take a listen to what she's had to say.
Further good news for Queensland, we have 0 overnight cases. So that's wonderful news, and we still only have 12 active cases in Queensland. So once again, I really want to thank Queenslanders for the incredible job that they are doing in really smashing that curve. Of course, our schools are getting prepared for next week when everyone goes back to school on Monday, and I want to thank all the principals and the schools community for working together, and we hope a safe return for all of our school students right across Queensland. Look, secondly, we also know that the June school holidays will be coming up very shortly, and of course with our roadmap it means that Queenslanders can travel up to 250 kilometres and they can holiday in Queensland in their regional areas. So I really want to encourage everyone as much as possible to start planning those holidays and really back our tourism industry. And a lot of people have been saying to me, can we actually travel in our school holidays? And absolutely, you can do those regional trips. So I think that's going to be wonderful for all of us, Queenslanders backing Queenslanders, to go out and support our tourism sector as much as possible.
So great news again from Queensland with no new cases, only 12 active cases. But that language between the states, it's kind of basically intensifying even there this morning with the Queensland Transport Minister saying Queensland will not be lectured to by the worst performing state in Australia, referring to New South Wales there. So the words of the Queensland Transport Minister. There's still a lot of controversy around just when the borders will be reopened. Queensland insisting that it's not going to reopen its borders anytime soon while there are continuing fresh numbers of infections in New South Wales and Victoria. And heading to New South Wales now, 2 new coronavirus infections have been detected in New South Wales. It comes amid this stoush between the states about reopening borders around the country. Reporter Lily Mayers joins us now from Sydney. Lily, g'day. So did the New South Wales Premier comment on plans to reopen borders for international students?
That's right, Joe. We asked the Premier exactly what the plan is for international students and how soon we could see it implemented. It has been suggested that international students could be let into the country early in an attempt to rescue universities struggling, particularly those in regional areas. They do contribute about $13 billion to the New South Wales state economy. So the sector has really felt the loss of international students, the absence of them here. If students were able to come into the country early, they would be expected to quarantine in hotels for 2 weeks. But the Premier has said the taxpayer wouldn't fit those bills, unlike for when Australian residents return to the country. This plan, of course, is very dependent on the federal government's decision, but the Premier, Gladys Berejiklian, has indicated that those talks have begun. Here's a little of what she had to say.
The plans are still in the formative stage. We're not in a position to announce anything. It would be conditional on what the federal government allowed as well in terms of flights. So can I please stress these are just early developments of the plan, but we need to think ahead. We need to think beyond the next few months. We need to think ahead about where the jobs, we can get the jobs back.
And Lily, did Gladys Berejiklian mention anything about changes to current restrictions?
Well, the Premier said she couldn't make any announcements today, but she has indicated that we can expect a new announcement soon to the changes of the number of patrons allowed in pubs and clubs. Right now, the rule is a 10-person maximum, but the argument has been made that many of these venues can host many hundreds and across separate areas and do so currently with safe social distancing. So the Premier says she understands that and the government will be reviewing those rules and hopefully making an announcement imminently.
OK, Lily Mayers reporting there from Sydney. These Victorian officials have just started their media conference giving their daily update on coronavirus. Let's take a listen into what they've said.
So I'll just start off this morning with the latest figures in terms of COVID cases. So at the moment we're now sitting at 1,581 cases, which is an additional one. There are some cases that have been reclassified that I'll get to in a moment. But all up in Victoria, we have 4 new cases, 3 household contacts to Cedar Meats, which takes their cases to 106 at Cedar Meats. The 4th case is under investigation. We've had 3 cases removed, 2 because of duplication, where you've been notified by 2 sources and it's ended up on the database and then had to go through and remove 2 that have duplicated and 1 that's been reclassified to another state. We have currently 88 active cases, 10 people in hospital, 5 in ICU. In terms of community transmission, we have 2 additional cases taking community transmission to 168. 378,600 tests have now been done in Victoria at the end of yesterday, which is just an incredible amount. And again, people continue to heed the advice that if you have any symptoms at all, please get tested, and that advice continues. Today's figures, there are no new aged care cases. There are no additions to any other recent clusters other than Cedar Meats, so no more at McDonald's. Just to give you a sense, the Villa Maria at Bundoora, they've completed all the testing there of all the staff and residents, 162 tests, and everyone is negative. And at the Hammond Aged Care, 132 tests have come back negative, and we're waiting on 20 tests there. So that's the update today in relation to COVID. I'd just say that, again, Victorians have been heeding the message, doing the right things, and even with the, easing of restrictions, people are still, following the advice around working from home, following the advice in relation to social distancing, and it's just so important that we continue to do that as we consider any further easing of restrictions going forward. So again, can I thank Victorians for, really following the advice, looking after each other, looking after the community as a whole by doing the right thing.
The World Health Organization is warning the coronavirus pandemic is far from over, with the world recording its largest spike in new coronavirus cases in a day. The WHO's director says rising case numbers in low and middle income countries is of particular concern.
We still have a long way to go in this pandemic. In the last 24 hours, there have been 106,000 cases reported to WHO, the most in a single day since the outbreak began. Almost 2/3 of these cases were reported in just 4 countries. We're very concerned about the rising numbers of cases in low and middle income countries.
Tedros Ghebreyesus there. And Brazil's health ministry has issued new guidelines for the use of 2 anti-malarial drugs to fight COVID-19, despite a lack of evidence that they work. The guidelines authorise the use of chloroquine and hydroxychloroquine at the first onset of symptoms, but patients will have to sign a waiver acknowledging the potential side effects. Brazil's President Jair Bolsonaro has promoted the use of the anti-malarial drugs after US President Donald Trump said he was taking hydroxychloroquine. More than 1,100 people died in Brazil just yesterday from coronavirus. In South Africa, thousands of people have received food parcels from charities in the capital, Pretoria. 11,000 packs of food and hygiene supplies were handed out to residents in informal settlements affected by South Africa's coronavirus lockdown. The aid packages included a 10-kilo bag of maize meal, various food essentials, face masks, soap and sanitizer. Scientists have warned at least 40,000 people could die of coronavirus in South Africa by the end of the year. US states are continuing to reopen, and Donald Trump has continued his war of words with China, blaming it for being responsible for what he described as mass worldwide killing. Here's North America correspondent James Glenday in Washington.
States are beginning to reopen here. The exception is the District of Columbia, where I'm based, and we're locked inside until June the 8th. And I think that is part of the reason why Donald Trump has tweeted his frustration again with China, because although things are reopening, they're reopening pretty slowly. They're incremental developments. More than 93,000 Americans have now died. More than 1.5 million have contracted the coronavirus. And every day, the president is continuing to be slammed for his response to this pandemic, particularly the way he acted in the first couple of weeks as it spread around this nation. And so he has taken to Twitter yet again to criticise China's response, accusing them of and claiming that they're totally to blame for the deaths that have been seen around the globe. And perhaps it was also kind of sparked a little bit by some comments that China made about the United States. The Secretary of State, Mike Pompeo, had praised the president of Taiwan.
The Mayor of New York has defended keeping city beaches closed for the Memorial Day weekend, as the rest of New York State and neighbouring states plan to open their beaches up. Sunny days and warm weather are proving to be challenging to manage as parts of the US partially reopen their economies after the lockdown. Coronavirus has killed nearly 21,000 people in New York City alone.
We are unlike any place else. Let me just start with us. We're the epicenter of this crisis nationally. We're the most populous city in the United States of America, one of the most densely populated places in the country. To get to our beaches, a vast majority of people are going to take subways and buses. That creates crowding there and then crowding on the beaches. There's such an obvious set of reasons.
And police have fined barbers for cutting people's hair during a protest outside the Capitol building in the US state of Michigan. About a dozen barbers and hairstylists defied stay-at-home orders to give free haircuts at a demonstration against restrictions imposed to curb the spread of coronavirus. The barbers have been cited for disorderly conduct after warnings by state police.
I need to provide for myself. I don't think I should be shut down, because if we all lived in fear like this, we wouldn't go anywhere. I need to be able to provide for myself and for my family. So I don't know what else to do at this point.
Greece is planning to start its tourist season mid-next month, with international flights operating from July the 1st. All major European destinations are gradually relaxing their lockdowns. France currently allows only essential travel from abroad and has not indicated when its foreign tourist ban will be lifted. Spain has started loosening restrictions on a region-by-region basis, and in Italy, beaches, parks, restaurants and bars will gradually open from June, along with airports. Retired New Zealand nurse Christine Archer has been reunited with her terminally ill sister after weeks of uncertainty. Ms Archer arrived in Sydney last week after the Department of Home Affairs granted her an exemption to travel to Australia after 4 rejections to care for her dying sister. It's so beautiful to see, because we interviewed Christine about a month ago and she was in New Zealand, and she was just beside herself because she'd been trying for so long to get into Australia to see her sister there, who'd been diagnosed with a terminal illness, and so she was finally able to get to see her. So it's just so beautiful to see them together there. So after a week in isolation, she was allowed to travel to her sister Gail's home in Bowraville on the New South Wales mid-north coast. Gail was diagnosed with advanced ovarian cancer in March.
I know it's an awful time at the moment with the virus, but I mean, there are some things you've got to be a bit lenient on, and I felt this was one of them that should have been. And it was just a terrible time. I did nothing but cry because I didn't think I was ever going to see Gail again. And that would have been the worst thing in the world if that had happened. Words can't explain how I feel, to be honest. I'm just so happy that I finally got to be here and be with her. The last 2 weeks have been the hardest or the longest 2 weeks of my life, I think. I don't actually know what we talked about. It was just la la la. It was just great just to talk, really. I can't recall what we were talking about. Family and cousins who want to FaceTime, and my grandchildren, and just everyone. My son in Canada. Yeah, it's just been wonderful.